So our next patient is little Gabe. Lisa, do you know if the family wants to participate in family-centered rounds?
Yes, I asked Ms. Perez this morning.
Good. So while Lisa does the presentation, Andrea will go ahead and have you write the orders and the scripts. And then Oz, our medical student, you can go ahead and time us. Make sure that the presentation's not longer than 5 minutes. I'll make sure that the family understands the language. Lisa, make sure to give a brief overview of the case and focus on treatment options and discharge planning. Okay? Do we have our bedside nurse?
Yes, I'm here.
Okay, let's go in.
Hi, Ms. Perez. This is the team taking care of little Gabe. This is Dr. Zern, one of our other interns, Dr. Carlin, our attending physician, Mr. Ortiz, one of our medical students, and Dr. Reyes, our supervising resident. And then you know your nurse, Rayan. So we're going to talk about his case and then come up with a plan together so we can best take care of him. I will do my best to use non-medical terms, but if you have any questions at all, Dr. Reyes will clarify for you. Okay. Gabe is a 10-month-old male who was admitted from the emergency department last night for acute onset of fever and irritability. Review of systems is positive for decreased activity level, vomiting, poor PO intake, decreased urine output, but negative for rash, seizures, diarrhea, congestion, runny nose, and respiratory distress.
She means having trouble breathing, and Gabe did not have any trouble breathing.
The baby is fully immunized. In the emergency department, he was bolused.
She means that they gave him some IV fluids to help rehydrate him.
And blood, urine, and CSF cultures were obtained. The CBC was reassuring. The CSF was consistent with elevated white blood cells, but the glucose and the protein were within normal limits, and the gram stain showed no organisms. In the emergency department, he did receive ceftriaxone. Overnight, he has had a fever. This morning, his exam is remarkable for some fussiness, but he's consolable, and otherwise, the exam is unremarkable. So, for my assessment, Gabe is a 10-month-old male with viral meningitis. I would like to make sure his CBC remains stable, so I'd like to repeat it. If his CBC is normal, I would like to discharge him with close follow-up with his pediatrician.
And Dr. Miguel, what information do you think repeating a CBC will give you?
I'd like to make sure he's not getting any worse.
Okay, and do you think that his clinical status, the fact that he's more active and alert and eating better and more consolable will give you the same information?
I guess so, yeah.
Good, so do I. I think that Gabe clearly has a viral meningitis and that he's going to get better. And I think it's safe that he can go home with his family, that is if the family is comfortable. Miss Bettis, are you comfortable taking your baby home?
I'm not sure how I feel about that. Ms. Perez, would you mind if I shared your concerns from this morning with the team?
No, that's fine.
Okay. Ms. Perez is worried because she has seen on the news that babies can die from meningitis.
Miss Bettis, there are two types of meningitis. Bacterial meningitis, that's probably the one that you've heard on the news. That is a really serious disease, and babies do need to be in the hospital on antibiotics for a long time. And sometimes it can have hearing loss and other serious consequences. But Gabe has a viral meningitis, and that's caused by a virus. He doesn't need any antibiotics, and he will get better all by himself. Okay, so I do think that you can go home.
So then my baby will be fine.
Yes, he will. But we do want you to have close follow-up with your pediatrician after he goes home.
Okay, then we're ready to go home.
Ms. Perez, as you know, we have both medical students and doctors in training on our team. Do you mind if I take a few minutes to teach them a little bit about the distinction between bacterial and viral meningitis?
Sure.
Okay. Well, let me start by asking our med student or interns if anyone knows if there's a predictive clinical tool in the literature that can help us distinguish bacterial versus viral meningitis in a child with CSF pleocytosis.
Rayanne, we've written your discharge orders, and the baby doesn't need any scripts.
Okay, thank you.
How was our time?
Just a little over 5 minutes.
Good. Let's move on to the next patient.
The team is here to discuss Jean's case. I believe you met everybody.
Yes, I am.
Remember to feel free to participate in the discussion, okay, as we go along.
Okay, thank you.
So Jean is a 7.5-year-old female asthmatic who was admitted 2 days ago with an acute asthma exacerbation as well as hypoxia. Overnight, her vital signs were stable. She's been on room air since about 2 in the morning. Her albuterol treatments have been going every 4 hours. On exam this morning, she's a little bit wheezing. However, she's moving air appropriately, and her respiratory phase is no longer prolonged. My assessment of Jean is that she's in She was in an acute asthma exacerbation, is much improved now, and I would like to send her home with a 5 days total of prednisone as well as her daily fluticasone. I have filled her asthma action plan, and Gina and her mom attended the asthma education class yesterday. So I'll have to call the PCP and discuss her admission after rounds.
Dr. Ortiz, what are her peak flows?
90% of her personal best.
Great. Ms. Perez, are you and Jean comfortable with that plan?
Yes, it's a good plan.
Jean, can you swallow pills or do you prefer liquid?
Liquid, I don't like swallowing pills.
Okay.
Excellent. Then we'll write a prescription for the liquid prednisone. Thanks, Rayanne. Ms. Perez, do you have any other questions?